I started using first, but I also started selling drugs at an early age too. My serious problem became when I got introduced to PCP, angel dust. I actually, did it for many years after that. I was facing a charge for drug sales. I realized, if I don't get this right, like, I'm done. Like, this is what my life is gonna be. I decided to go to school. I decided to become a drug counselor.
I started in the Staten Island DA's office in Richmond County in December of 1997. When I was doing trial bureau work, I started doing narcotics investigations. Part of my work there was to develop a diversion program for misdemeanors at the low-level possession of drugs. And then when I came over to Brooklyn, they were starting a similar program. So the DA asked me to come on board to get that program off the ground, and that's Brooklyn Clear. Our goal is to make sure the person that we're dealing with never comes back. And as we evolved as prosecutors, we sort of learned the different ways to make that goal achievable, whether that be reducing the trauma of the arrest, connecting someone to services, and kind of focusing on the health issue that's causing them to commit crimes. Then they stay out of the justice system, they don't repeat offend, and they get healthy. When I came to Brooklyn, the DA had already decided that there was no limit on how many times you could do the program. DA Gonzalez understands that substance use disorder is a disease. It should be treated as a public health issue, and that it doesn't go away overnight. So people are going to possibly get rearrested or come back in contact with the justice system, and therefore may need 1, 2, or 3 touches before they change their behavior. So, or maybe they don't, and we just need to find a harm reduction answer for them to keep them alive and safe. We brought in people who had been through the system. And we said, when you were arrested, what did you wish you got? What did you wish you had been offered?
A lot of times when you ask individuals, why do you do what you do? They can easily say, well, we've never been offered anything better. We've never been given assistance, given help to have us do different. So all I do is what I know how to do.
And that's where we came up with the just do something. He's like, I wish someone would have just done something. Just do something turned into what meaningful engagement has become.
We assist individuals at their most vulnerable moment, which is when they get arrested. We get notified by the district attorney's office. A peer is sent into the precinct, and we assist them with any immediate needs that they might have at the present moment. So like if we go to a precinct, the individual might be hungry. We actually wait for the individual if he's going to get released very soon. We wait for him. Hey, you want to go get something to eat? Which gives us more time to be able to engage with them and build that rapport with them.
The peer then is given a private space inside the precinct if they want, or they can leave and take the participant somewhere else. And they have this conversation about this program that they are potentially eligible for. They describe what the program is like, the requirements.
The requirement is that they engage in some form of service that's beneficial for them. So it can be, from anything from obtaining documentation, having an individual peer session with a peer, or, entering treatment, receiving mental health services.
So that we can find out if there's something immediate that the person needs. And they give them the naloxone training, and they give them the kit, and they give them education around why it's important to have it, even if you're not a heroin user, because fentanyl's in cocaine and fentanyl's in marijuana. And so you need to be aware that that's what's killing people. And this naloxone will work to help reduce that risk. Also, the peer's important function is getting good contact information. When the police officer's asking for your name, your address, your phone number, you may not get a phone number from that person. But when the peer is explaining that, hey, if I can call you in a couple of days to schedule your appointment or get you to come into my office so that you can get your case dismissed, but I need to call you, they're going to give you a good phone number. And then from there, they do the assessment with the case manager, who then says, tell me what you need. How can I help you?
The individual might want assistance. He might be living from couch to couch. He might, and he wants to start housing, putting in applications.
I don't have a government ID with my picture on it. And it keeps me from doing these other things that I need to do. The peer and the case manager will get the person to DMV to get a non-driver ID or to get a copy of their driver's license. And when they do that, that's engagement. If it's, I haven't been to the doctor in 2 years and they schedule a doctor's appointment for them, when the participant shows up at the doctor's office, that's engagement. We as prosecutors have this sort of control issue that we want to make sure the case is handled the way we want. And we have the accountability, but we are not the ones who decide what a person needs.
I've had individuals, deal with me for a month or two, and then a few months down the line, they call me back and say, hey, I've been thinking about it. I want to get into treatment. Working with somebody, assisting them, in any aspect of their life, especially more because I have a passion with recovery, assisting them with substance use issues, seeing them one day during my lunch hour, walking down the street with a woman and a baby carriage, and they say, hey, I want to introduce you. This is my wife. Hey, honey, this is the person that saved my life. I know why I'm here. I just try to do the best that I can at it.